The purpose of post-operative compression garments is to reduce the bruising and swelling that you experience after surgery. They aid in faster recovery and improved final results. They really tend to support the surgical site during the healing process. Wearing the garment as directed will lead to faster recovery times and improved final results. Not wearing post-operative garments as directed puts you at increased risk for bruising and swelling and possibly even leading to seroma formation, which may require further intervention. So wearing these garments as directed is extremely important to avoid those complications. You can expect to have different types of compression garments after various different procedures. For example, after a breast procedure, you may have a supportive bra like this. After a tummy tuck or an abdominoplasty, we typically use abdominal binders, such as this. And then finally, a more extensive compression garment like this is often used after liposuction procedures. It's essential for compression garments to fit properly in order to be truly effective. So we want them to be snug against the skin, but not uncomfortable. You definitely want them to be lying very smooth against the skin without any significant ripples or cutting into the skin. If garments aren't fitting properly, you may notice a couple of things. If the garment is too tight, you may have some discomfort overall, potentially even pain, and you may notice that seams are cutting into your skin and causing some irritation. On the other hand, if the garment is too loose, you may notice areas of increased swelling, and you may even be able to feel that the garment is not snug against your skin, which is what we really want to see to get appropriate compression. Most of the garments that we provide after surgery are very easy to wear and easy to take on and off. The garment that we get most questions about is the abdominal binder after a tummy tuck procedure. So this garment is to be worn with the seam against the center part of the spine in the back. And then you want to make sure that the label, which is on the inside, is facing upward so that the taper of the fit of the garment is wider at the hips, and it allows the garment to stay in place appropriately. Many patients find it more comfortable to wear a compression tank top or leggings underneath of the abdominal binder. The important thing to note there is that you want to continue to have the binder be tight enough and lay smooth across the clothing. It also needs to be placed low enough on the hip so that it covers the entirety of the incision. So patients typically will wear some form of compression garment for approximately 6 weeks after surgery. The initial garment placed at the time of surgery tends to become a little bit too large for most patients after their swelling starts to go down. So around the 2-week mark, most patients are moving down to a smaller sized garment and maybe a different type of garment, depending on what they're comfortable in. One garment is typically provided and placed on the patient on the day of surgery. Many patients find it helpful to have a second garment during that first 2-week period so that they can have one to wear and wash the opposite. And then after the 2-week mark, when we're reevaluating moving down to the next phase of compression garment, we can provide additional recommendations for the next step, or you can purchase them from our office. Many patients find that their post-operative compression garment provides a lot of support for them and decreases their discomfort, and they like to wear them even beyond the 6-week mark because they're getting back to their normal activities at that point and they like the extra support, and that's completely fine. If at any point you have any questions or concerns about your post-operative garments or you need guidance on the next step for your garments, please feel free to contact our office.